Good evening, everyone. My name is Danielle Mitchell. I'm the CEO and founder of Black Women in Clinical Research. Tonight we have DREF. We're going to have a conversation with Dr. Brittain. Dr. Brittain, would you like to introduce yourself?
Absolutely. I am Kelly Brittain. I am the DREF Research Matters for All of Us, a research group manager. And I'd have some slides that I'm going to share if I can just dive in now, Danielle. Oops, that is the wrong screen. I'll stop sharing that screen and share the PowerPoint. There we go.
And you're also from Michigan too, as well, so you
I
can
am.
relate
So,
to.
yes. Oh my gosh. So the relating of the horrible weather conditions, definitely. School, as Danielle said, has been out. I actually live a little bit north of Metro Detroit, so I think I just get it a little bit worse. So we will indeed start over again in winter, come February when the temperatures will then reach above freezing or slightly below. You know what? It is really my pleasure to be here to talk to all of you and to help you understand and learn more, I hope, about how to use the All of Us database and research program to advance your research, either as a faculty person, if you're in a doctoral program, postdoc, if you're a high school science teacher, if you are in bench research and looking to do something else or anything. So, really, this is a pleasure to be here to share with you not only about the All of Us program, but also how DREF is a NIH awarded community engagement partner in what we do. And then I'll close the rest of the session with really how do you then register for the workbench? What are some of the resources there? How can you think about utilizing this in your work? Danny asked to put you guys to put in where you're from, if you feel comfortable. Also add, what are you doing in clinical research or what are some of your research interests? And with that, this is again, tonight's program. I am the research group manager, and as I go through the presentation, it'll be more clear, like what does that really mean? A little bit about DREF. DREF is the philanthropic arm of Delta Sigma Theta Sorority Incorporated. It was established in 1967 to really promote research that is specific to identifying and creating solutions for African American women and their family, not only nationally, but globally. So, DREF itself has five programs: civic engagement, education, financial literacy, health and wellness, and international awareness. Um, how did DREF become a part of the All of Us research program? Well, about 8 years ago, the All of Us research program had a call out for national organizations that could work on community engagement. And DREF was selected as one of several community engagement partners. And so, why did the All of Us research program want community engagement partners? Because the All of Us research program is a longitudinal research study that is really trying to get data from 1 million people, from diverse backgrounds, of diverse age groups, to then broaden and reach the idea of precision medicine. Precision medicine was actually a part of the Obama administration. And really, what it's looking at is that the advances in very broad-based treatment plans and prevention, we're realizing that in some instances, those things may need to be individualized, but we can't be sure to what level of individualization it needs to happen, just from a biological standpoint, genomic standpoint, mRNA standpoint, or those things that we understand are the social factors of health. So this ambitious program is trying to address all of these potential pathways to precision medicine. So really what this program is also trying to do is, one, through the community engagement partners, establish relationships with at least 1 million participants that agree to not only provide information on the social factors of health, but also access to their electronic health records and also biologic information either through Fitbits or through saliva samples. And then come together and bring an ecosystem and cultivate an ecosystem of researchers and community researchers and community groups that are community engagement partners that will then help utilize the database to give different perspectives, but also help ensure that the data is being used well and that communities are being respected in the process. So again, there are those people who are a part of the actual research study, and it's open to anyone to enroll in the research study. As I go forward, I'll show you some of the questionnaires folks fill out. You can stop right there and just fill out questionnaires. You do not have to give your access to your EHR. You do not have to provide genomic information to be enrolled in the study. There's also healthcare providers involved in the study. There are health provider organizations that are also responsible for not only going out and recruiting participants in the study, but they are also a part of ensuring that some of the diseases and disorders that they're experiencing are at the forefront of where researchers are spending their time. And then also involved are biomedical researchers. And I tend to think of this not only in the biomedical sphere, but also in the ways that other scientists look at health data. And that includes social scientists, those that are in health sciences, but may not be doing quote unquote bench work. It also, because this is a huge data set, important to this are data scientists as well. So what the All of Us program is hoping to have happen is that the participants share their data. Participants do get some information back about their health based upon the genomic pieces and some of the other maybe Fitbit studies that are going on. They want researchers to utilize this data. The data is well protected. And then researchers are expected to share their discoveries so that we can continue on the mission towards precision health. So for the participants, there is a lot of information. It's a two-way feedback, meaning that participants provide the research program with EHR data, genomic data, Fitbit data in a very trusted, secure way. And then for researchers, they're able to then develop and use this large database to advance science. Again, this particular pathway is open to scientists of all backgrounds. And when I say scientists, it means any and everyone that is interested in utilizing the data to inform healthcare decisions, healthcare innovation, healthcare interventions, and outcomes. So DREF was awarded the community engagement part of the grant back about 8 years ago. And we've really grown since then. As you can see, we're a full organization with a principal investigator, Cheryl Thomas, and a co-principal investigator, Dr. 𝐏𝐫𝐨𝐬𝐿, who really functions as our lead on our enrollment side. So In the community engagement side, and I'll tell you a little bit about all the things that go on. We also have sub-awardees with Mocha Moms and Morehouse School of Medicine. One of the newer initiatives of the All of Us study is to enroll pediatric populations. And Morehouse School of Medicine also is a part of the enrollment and community awareness pieces of the project as well. This is the team. And here are the things that we do on the engagement and access side. So we are in 7 cities across the United States, and we host community engagement workshops, programs, and outreach um, among a variety of populations in all of the cities, and actually in some of these areas across the states that they're in. And the primary purpose of the engagement and access is to make the community aware of the All of Us program, as well as disseminate information and health related information. So in your city, we may hold a webinar, a community gathering where we might talk about high blood pressure, fibroids, lupus, and also at the part of the program is also to talk about what the All of Us Research program is and encourage folks to enroll. Now, DREF also does enrollment and retention. What that means is then we have now moved past awareness into actually being able to collect the saliva from individuals as well as help folks get enrolled. Now we are also responsible for those folks that we enroll in the study. We're responsible for making sure that they stay with the All of Us research study. This is a new aspect of our program, which we were awarded this expansion of our partnership with the All of Us Research Program in 2025. Now, one of the biggest things that we do with DREF is the research component. And actually, the research, again, goes back to the participants sharing their data, the information that the participants give us is actually put in a secure repository, which I'll talk about when I talk about how to register. Then registered researchers, again, there are 3 tiers of the data.
Next week.
And only the highest tier can you actually get to
Right.
some
Thank
of the big data. And then we're expecting registered researchers to use the Researcher's Workbench, which is a secure workbench in the cloud, to then analyze the data. So you cannot get the data and then pull it down to your own personal PC. Everything that you're doing, the analysis and other things, has to be done within the cloud or in a Jupyter notebook. And then there are publications that you can, as interested individuals, can look and see what's been published. Anyone can visit the Research Hub to take a look at the big aggregate data in the data browser. And then I'll talk to you a little bit more about the data browser and how to register. One of the aspects that we're very proud of on the research side of things are our partnerships. The part of our partnerships is one, like you're attending this webinar today, is to increase awareness of how to become a registered user on the All of Us Researchers Workbench. Right now, you can see Black Women in Clinical Research is one of our partners and has been for the last 2 years. We've also been partners for the last 2 years with the Black Nurses Association and Black Researchers Collective. One of our newest partnerships is the Black Women's Health Imperative. Really, the goals are increase awareness, but also increase the numbers of researchers using the workbench, either in coursework that you're teaching in high schools or in colleges, or in your research, either with students or your own. And then we're also holding a national research symposium in June where we have a national keynote speaker and also one of a researcher that is using All of Us data to inform and publish their research. That's one aspect. The other thing that we do in our research group, we have partnered with 5 universities across the United States. We're looking to partner with 2 more in 2025 before the end of June. And in this partnership, don't have that. In this partnership, we actually work with our colleges and universities to increase their capacity to use the workbench. What that means is that we have an appointed person at each one of these universities has agreed to find every year 6 faculty to be trained, to register and be trained on the workbench. We supply funds for some stipends. We also supply funds for travel, as well as ongoing support for sometimes publications as well, and summer research projects at these 5 institutions. And we've been doing that part now for about 3 years. So the research side of our work was established in the winter of 2023, and I've been with the program. I started out on this community engagement side and then moved over to the research side. Within the research group, we also have a student mentoring program, which is for faculty at the universities that are on the other screen. And they work with student mentors, and these could be undergraduate students or graduate students to complete research projects. Since we've been working together with faculty, we're now seeing more publications. The faculty are publishing. Their students are having posters accepted at 𝐏𝐫𝐨𝐦. So we're now starting to see that now that the faculty have been on the workbench and really using it in coursework or with research, we're seeing the fruits of their labor. Also, we have a collaborative project in Louisiana with a high school science teacher with Dillard University to work with 4 students on research projects using the data browser. Oh, I do have the college and research program. So again, the same emphasis is really to register and support faculty to use the workbench, either in coursework, with students in student research, or with faculty research. Again, leveraging all of that support. We've been doing this now for about almost 3 years. Another program of the research group is our DREF researchers. And the goal of the DREF researchers, which we're getting up to about 9 this year, which will stop at about 9 or 10 researchers, we are engaging pre-docs, postdocs, and active faculty at universities and at institutions that where they are actively engaged in clinical research to elevate using the All of Us researchers workbench in either coursework or in research or with students. What I want to share with you now is that there are many ways to engage with the All of Us platform without actually having to become registered. And one of the primary ways to do that is with the data browser. And with the data browser, this is actually public data, and anyone can see that. And so what I'm going to do, I'm going to pause and I'm going to stop sharing because I want to actually show you the data browser as a part of this presentation. So let me find the best thing here and here. And here in the data browser, and this is Danielle's going to send you all the presentation, which has all of the active links in it. As you can see in the data browser, according to everyone that has given access to their EHR, there are over 354,000 participants. Now, this is big data. This is tremendous. And so there you can actually look at the conditions that folks have primarily in their EHR data presenting as their primary concern or reason to go to the physician. this aggregate data is how we are interacting with the high school students in crafting their projects. And as you can see, a lot of this information is public health related information and could be very interesting as people begin to explore particular conditions. There are drug exposures, lab measurements. If you are into genomics, there's some SNPs and things like that in there. Then there's the measurements that I mentioned, the physical measurements. This is when people go to some of the health providers where they're able to take their physical measurements. In the database, there are over 500 participants with physical measurements. Not quite as much as Fitbit data, but again, in research, if you're getting 1,000 participants, this is very valid data. Some of the things that I want to share with you about the data browser, as well as when you're considering whether or not you want to register, you may wonder, well, some of this information is good, but I'm not sure if this is relevant to the ways that I want to study, or how I study different variables. One of the things you can do in the data browser is actually view the complete survey, I'm sorry. And you can download it, and you can see exactly some of the 25 questions that are in these. This is just the basics. We go back. One of the things that I think is really interesting, because these surveys that folks complete, and you can see in the most people complete the basics. It gets a little bit, because these surveys are long, it gets a little bit fewer and fewer, because they're really long. Let me open up some of the questions. There are 80 questions in the social factors of health. And this is kind of really good information, especially if you're looking at environmental effects of health. There is some indices of how people view and perceive their neighborhoods. There are some zip code related data in here as well, so people can do some geolocation and things like that. Um, if you're so inclined. So what I'm gonna do while I have this up in the chat is copy that and then put this in the chat. So that way, as I'm chit-chatting and having our conversation, you can go back and take a look at the data browser. I'm going to go back to the presentation here and show you just a little bit more that you can consider when you're looking at the All of Us program. So one of the things that I want to share with you, oops, it's giving me a different view here. Let me start here. Is that there are in the PowerPoint presentation, before you even decide about how you want to engage with the program, there's the All of Us Research Hub, there's a Researcher Workbench, and there's even ways that you can explore the publication repository. What I'd like to do now is actually tell you, how do you register for the workbench? And then what I'll do is once I finish this portion, we'll stop for Q&A, and then I can go back and explore and show you some of the other websites as well, the web links, so that you can really get a sense of some of the great information that's already there to help you make an informed decision about whether or not this is going to work for you. It's really easy. It does not cost anything to register or create an account for the workbench. We do want you, if you do decide to register, please identify that the Delta Research and Educational Foundation is the organization you receive the information from. Then you create your your IDs. They do use a secure identification verification through login gov or id.me. When you're going through and becoming registered, there are mandatory trainings that you have to take. Again, the data browser is open for everyone because it's big aggregate data. However, if you're going to do more data where you want to get more fine-tuned into the population, you want to drill down on certain demographics, you want to lean into certain conditions, then you have to at least get to the registered tier. The registered tier allows you to access aggregate data, but it gets to be a little bit smaller and you can be more specific in terms of how you're going to be specific about your sample population. If you are interested in the genomic data, the other Fitbit type data, you must then complete the controlled tier as well. If you've ever taken IRB training, all of your IRB related training about secure databases and websites and how to not harm your study population. That's the same type of responsible conduct of research training that is done in all of us. It does not take very long to take the actually the registered tier training. It sometimes takes a little bit longer to do the control tier because it gets really into specifics about how all of us and what they do to secure data and make sure that you cannot drill down and actually begin to identify subsets of the population based upon your research and your research analysis. You do have to renew this and take the responsible conduct of research training every year. Taking the training for both tiers could possibly take you maybe 4 hours to get through both training tiers. The final part of your registration is signing the data user code of conduct, which just says that you agree not to do harm in the ways that you're accessing the data, you agree to keep it secure, and that you abide by all of the rules and guidelines of the program. Now, if once you get registered, how do you go about getting trained on the database, the data set? If you are used to R or Python or SAS, you won't have any problem analyzing the data. The great thing about Python is that it's open source and that because the research workbench has been around now for about 3 years. They're actually upgrading. There's a lot of coding language and other information on how to analyze the data or how to use the programming language to get the data that you need. And all of that's free, right? There are RTI has an Amaze platform, and they have online courses that you can take. New York University, there's a biostatistical consultation service available that's free and is at no cost for early and mid-year researchers, up to 15 hours of consultation. And that's very good. Normally, you won't need 15 hours. 15 hours will kind of get you through a full project if you don't have a data scientist or if you aren't a data scientist. Now, if you're a data scientist, or working with one very closely, then you have a definite advantage. So with that, I'm going to stop sharing and open it up for questions that you have about using the All of Us research platform or anything that you're interested in hearing me answer. Hi, Alicia.
Hi, thank you so much for the presentation thus far. It's definitely been very informative. So I had a question more from an applicant or a participant's perspective.
Mhm.
So when they're completing the survey, is there a way for them to exit the survey and then come back and complete it?
Yes, there is. Yes, you can save your progress and then come back.
Thank you.
Yep. And then, one of the other things, of course, like I would say most research these days, I'm gonna knock on wood, where folks can then, at any time they can decide to not be a part of the study and withdraw from the study as well. So I am registered as a participant as well as on both sides of the research tiers. I'm on the registered as well as the controlled tier as well, because I really do want to see what does it mean to be a participant, and then also be able to see how do I access this information as well. Okay, any other questions? Thank you, Danielle, for putting LinkedIn there. I'm going to do this too. I'm going to put my email in there. And then I'm going to also we'll just take a minute to explore some of the
May I ask a question?
yes, absolutely.
Oh,
I raised my hand a couple of times. I was like, where did my hand raising
Sorry.
go? It's okay. Good afternoon, good evening, sorors. I'm a physician and I'm
Yes.
retired from clinical practice. And what I do in life now is educate about menopause.
Mm,
And when I tell you, I just do not feel like there's anywhere close to enough information on menopause in Black women because
mm-hmm.
they're just not, yes, the SWAN study has improved a lot of things, and there's another study in Boston, but, you know, there's just nowhere close to enough information. And so I am just blown away by the existence of the whole fund as well as the all of us and whatnot. So I guess my question becomes, what if you sign up as a researcher or a consultant and things like that, and you get access to information, what's more important, getting more people in to the database
Mm.
or taking the information in that database and putting it in a position where it is informative towards improving health outcomes? So really that's my question, because that would be my interest
Yes.
more
So
so than
I
anything.
I absolutely love that question. And then I'm gonna share with you how you can I'm gonna share with you how I would answer that question, because it's actually both, but this is a great question. So one of the things that you can do in here is look at the research project directory. This is where I think, when your question about which one is most important, this is what I was doing maybe a couple of weeks ago. Hopefully it'll come up great. So we're going to put in the word menopause. And let's see in the total projects, and what this gives us is in real time, how many researcher workbench projects are up in looking at menopause. As you can see, there are only 144 projects, right? And from there, you can go in and you can actually look at what folks are studying. Um, let's go and see what Kimberly is doing at Colorado State. She's looking at developing a symptom-based measure. Click there. And so what I also will tell you about the Researcher Workbench is that in order to then be able to pull down the data, you have to then, before then, you have to be able to have a research question. So this is what Kim put in to her workbench so that it substantiated the use of the data. This is what I really, really like about the program, is because you can't go in here blindly. If you're going in blind, that's where you use the data browser. That's where you kind of look at what are the questions that are being asked. So you can actually kind of determine right then and there, well, this does have some of the measures I'm looking at. This is kind of the way I'm thinking about things. It does have these physiologic measures. It does have this particular societal or pain related or conditions in there. Oops. And so she's looking at a symptom-based measure. She's going to integrate multiple data sources. So also, what I will say about using the database is that you don't have to just use all the data that's in here exclusively. You can refine it in such a way that you can use some of this data, and maybe you're pulling data from Tennessee, or you're using this as a comparative data set. So that. So I would say, um, in this case of menopause, it would be very much important that we have researchers accessing and doing work in menopause. But I can't say, because I haven't dived into the demographics of the individuals that may have answered those questions. So let's say if I'm interested in particular African American women, and there aren't a whole lot of African American women, then I would say it's definitely that we want to get more African American women enrolled. Maybe it's a lot of African American women enrolled from the North, right? From the Midwest, from the East Coast. But then there's not enough women enrolled from the South. Again, we want to have, from getting 1 million people to participate, we want to make sure that we have enough people, enough populations represented so that when people are in here doing research, coming up with the innovations, coming up with the questions, that we have enough representation to be able to, I would say, at least make some great associations, depending upon the modeling. Maybe there could be some causality that could be pulled from. Did I answer your question in a roundabout way?
More than a roundabout way. I've got like 3 other questions now, so
I would
it's all right.
love to. One of the other things I want to share, which is a part of this, is the publication. So again, they're interested in publications as well. You can go in and type in menopause.
Mm-hmm.
Only 3 publications,
Oh,
right? So
okay.
again, and I will say that when folks begin to publish and say that they're using this database, because again, this is large data,
Mm-hmm.
folks are getting published and getting published as well as posters out of their work as well. So,
Okay.
and these are recent publications within 2025, which is still good because we consider that the data has only been available since 2023. We know
Okay.
how long stuff takes to get published. A lot of times, sometimes you are in a review stage and things like that. It was accepted maybe in 2024 and doesn't get published until, 2025. So we're
Mm-hmm.
now starting to see a lot more publications. The goal this year is to have even more publications from the data.
Excellent. So
Right.
do you have to be affiliated with an institution to be one of the researchers?
In order
Or
to,
educational institution, rather?
actually, no. What I will say is that there is a way to determine if your organization has a data user registration agreement.
Okay.
And I'm going to show you that site there. That's not the right spot. Registered institutions. So here is where you can find if your organization that you are a part of has what they call a DORA, which is a data use and registration agreement. I can never remember if it's use or user, but it's data use and registration agreement. There's a lot of institutions that have them, and some that don't. Um, some are educational and some are not. You can just take a look at some of these that are listed up top here.
Mm-hmm.
You can see 23andMe. Some are science companies, some are laboratories,
Okay.
some are even a managed care pharmacy.
Wow.
It doesn't matter, right?
Okay.
Some is a recovery center. anywhere, and this is what's so nice about the All of Us research program is that as long as you are employed with an institution or someplace that is willing to engage in research, then you can submit a request to get a data use and registration agreement.
Okay.
It's fairly easy to do
Mhm.
that. Um, and you fill out the form. Do they have a website, affiliation? Who is some of the institutional signings? Again, how did you learn about it? And
Mhm.
where's DREF? DREF is right here. So
Mhm.
even when you go get your DORA, you can say that you learned about it from here.
Okay.
One of our other partners, Black Researchers Collective, decided that they wanted to get a DORA, and they have a DORA. So they did that, and it took them about from application to registration, maybe about 3 months.
Oh, wow.
Yeah. So it
Okay.
doesn't take long. If you don't have a DORA, if your organization you're with doesn't have a DORA, that's
Mhm.
not a problem. Once your organization has a DORA, then you can enroll to become a registered user.
Oh, wow.
Yep.
That's powerful.
Great.
Thank you. Oh,
Yeah.
I do have other questions, but I'll wait for other people.
Okay.
We did have a question in the chat.
Yes.
Let's see. Rochelle asked about Meharry, if
Hmm.
Meharry could be considered. And she asked about the June dates, if the June dates are posted.
The June dates hasn't been posted. If Meharry would like to become a DREF related institution, just send me an email and I'm happy to talk to anybody, the right people that I need to talk to about what does that mean. I am absolutely sure one of the things that and part of the folks that we work with, I'm sure, see, Meharry already has a DORA, which is great. So that is one thing that we wouldn't have to worry about. The next thing would be if Meharry were to become one of our partnered institutions, we would want a dedicated person that has relative access to faculty and students, and really focused on how to engage the medical students in research. And that would be one of the things under our consideration in bringing Meharry on board. So send me an email.
Thank you so much. I'll make sure I send you an email after.
Great. Also, if there are any, I have in the DREF researchers pilot that we're running, and when I say by pilot, in the DREF researchers, we are doing some one-on-one mentoring and educating on the workbench, and then at the end of June, they will submit a plan of how they want to engage with the workbench. I have about maybe one or two more slots. We are really looking for members of Delta Sigma Theta, but I am willing to leave one spot open for a non-Delta researcher. The time commitment is 20 hours a month. What does 20 hours a month mean? What it means is that on your free time, you're going to go through the data browser. You're going to figure out what variables you're going to study. You're going to figure out what's your research question. Then you're going to set up your researcher's workbench. And then we're going to work together in some of the analysis. We're going to talk about how to integrate the All of Us researcher workbench into your coursework, into your student research as well. We do offer a monthly stipend for your time as well. And that is also what I have to share with you all today about the All of Us research program and how DREF Research Matters for All of Us is really a full-scale partner with the All of Us program. If you remember, We do it all, right? We start off with engagement and awareness, and then we help those individuals interested in enrolling and staying in the study. And, as Donna mentioned, is equally important, we're involved in the research side, making sure that diverse perspectives and diverse people know how to access and use the data in the database to advance innovative solutions that don't leave anyone else out. As we all know, a lot of the medical discoveries in terms of medications, 60-year-old white men, and then later we realize that these drugs are not as efficacious in other populations and in other people. This is what we want to prevent by having diverse researchers involved in analyzing the data. This is why we need diverse populations to enroll, right? Because often in enrolling in clinical research, it's a matter of convenience, right? And a lot of things that researchers do, and these are at high levels, is a matter of convenience. Exactly. When you typed in fibroids, you probably didn't find anything, Danielle. That was one of the things that I was looking at a couple of days ago, which means to me, we need some researchers to do two things: have an interest in fibroids, and then use the All of Us researcher database to see if folks in the database have identified fibroids as one of their conditions. And then also you can use it as a comparative database in maybe subsequent in populations you've already studied. So I
Right.
always kind of raise that as well, right? You don't have to use it as just primary. It also could be comparative.
Yeah, I saw Donna's question. When I put in fibroids, all of the other ways that they classify fibroids came up too. So they
Oh,
did
good.
capture not just fibroids, but the other classifications
Great.
that people
Okay.
put in there. So for
Yes.
my age group, I think it was what I saw was like over 20,000
Mm,
people have put that they have fibroids. So what I probably will do also is that and you're probably already connected to them, the White Dress Project. I have been speaking with them, and because I have fibroids as well, I've been doing like my own research and
mm.
seeing, okay, well, how many clinical trials, how many fibroid clinical trials are there, and just kind of, doing my own research and connecting with other organizations that are talking about, fibroids and I know the White Dress Project came up when I was researching, but I'm going to connect you with the founder because the founder is a Delta as well, for the White Dress Project.
Okay. It sounds great. I see they do have some demographics in the data browser about the demographics of the current participants. They don't, if you do have a Fitbit, you can. In some other studies, people were given Fitbits to participate. So it depends upon whether you have one already or if someone is actively enrolling folks to use their Fitbit. And we do have a community engagement template to solicit partners. And what I'll do, I'll make sure that I get that over to Danielle about how to enroll into the database. I forgot to put that QR code so that folks could have that, but I will send that separately. Great. Um, Happy to answer more questions if you have more questions about using the database or any concerns. I will say that when you enroll and you become a researcher on the workbench, they give you a $300 credit, which is like the annual cost of, if you're going to be a heavy user on the database, it might take you 2 years to use up that credit. If you are a lightweight user, um, it's going to take you a little bit longer to use that credit. But again, it's not, when you think of big data databases and $300 and they're giving it to you for free so that you get started, that's almost like a great deal, you know, um, to get access to be able to analyze um, thousands of participants in certain health-related categories. Hi, Michelle.
Hello, good evening, Soror. I have a question. I know you mentioned I joined late, so first of
No
all, I
worries.
wanted to say that. So I apologize if I'm making you repeat anything.
No
But
worries.
I heard you mention like how people can join the workbench or become researchers as part of this. Are there like clear pre-qualifications or requirements that people have to have in order to submit for that?
No, because actually the only qualification you have to have in order to register on the workbench is you have to work for an organization that has the data use and registration agreement, or DURA.
Okay.
And that would be the only thing. And there are a lot of organizations in the database that already have their DURAs, as they're called, and they have both the registered and controlled tier access. If your organization that you're working for does not have one of those agreements, talk to the appropriate folks at your institution. You can apply, and then within 3 months, usually the doors are approved. And once that's done, any person that's employed there can then register to use the workbench.
Thank you so much. That's so helpful.
Great. Well, it has been lovely talking with all of you. I am inspired because all of you are here on a Tuesday evening after work, trying to, hear how to elevate and continue all of the excellent work and inquiry that is so important to the health of African American families and African American women. If there's any way that I can help you navigate the All of Us platform, help you connect with any folks within DREF Research Matters for All of Us, please send me an email. Thank you, Danielle, for this opportunity and for being such a vital partner in our work to elevate the All of Us research program, as well as increase the numbers of diverse researchers accessing the All of Us Researchers Workbench and All of Us data.
My pleasure. It sounds like I might need to do it for BWICR so that the members can have access to it.
It would be great.
And let's see, I do see some comments. Okay. Yep, I want to thank everyone for attending. I know we have quite a few deltas in Black women in clinical research as well. So I hope everyone was able to connect and drop in their LinkedIn URL in the chat. But I want to thank you, Dr. Brittain, for coming and explaining to us about the platform and how to use the database. Like I said, I went ahead and searched some things while you were speaking.
Mhm.
But thank you so much. And please feel free to reach out to either one of us if you have any questions. I'm Danielle S. Mitchell on LinkedIn. But thank you so much, everyone. Have a great night.
Thank you all. Have a great night.